right. Thank you so much, Rhonda. I'm so happy to be here. But my name is Christynne Helfrich. I am one of the doctors of physical therapy on the clinical team here at Hinge Health. I have been a clinician for over 15 years. I'm an orthopedic certified specialist. I've been with Hinge Health now for almost 4 years. So it's been such a wonderful journey to kind of be in this digital space and to be able to provide care for a lot of folks that, might not be able to make it to a clinic. I think we all can appreciate how hard that is to go to a clinic 3 times a week, take your time, spend your money. So it's just been really great to be here. So, Rhonda, that's such a great intro on just, you're kind of touching on the complexities of pain, and I'm really excited to kind of nerd out a little bit and really break down pain because one in two Americans will have chronic pain, or maybe even on this call. A lot of you probably have. I know I was traveling, I've got neck pain, I'm carrying kids, something always hurts. So it's none of us are immune to it, but it can be really complex and can get really tricky. So I do want to dive in just on the overview of pain complexities. I do want to dive into the science of pain and how it really works, and then why pain is so unique to everybody. And then I do want to spend a little time just debunking some myths around pain. And then I do want to talk about how Hinge Health can help. And if you are struggling with pain, how you can get started. So, but before we do, I do want to hear from you all. So I've got a fun little trivia here. So just feel free to pop it in the chat. So the first one, true or false, the use of pain as a vital sign may have contributed to the opioid epidemic. So, what do you think? True or false? True. Yeah, you guys are absolutely right. I mean, it is really interesting because pain was introduced as the fifth vital sign in the mid 1990s. Now, this concept was popularized by the American Pain Society in 1996 to emphasize the importance of assessing pain regularly in clinical settings, alongside, the traditional vital signs of, temperature, pulse, respiration, blood pressure. But between 1997 and 2007, opioid prescriptions in the United States rose by approximately 400%. So, really interesting little tidbit there. Okay, the next one is low back pain means that you have a weak core. What do you think? True or false? True, false. This is a tricky one. A little bit of everything. This is kind of a trick question because while weakness can be a factor, it is not always the case. There are a lot of different causes for low back pain, from genetics, arthritis, muscle tightness. Weak core usually gets all the glory, but it is one very small piece of a very big puzzle. So that's just a little fun fact there. All right, true or false, improving your posture will decrease your neck pain. True or false? Okay, I see a lot of truths. Okay, well, thank you. So, improving your posture will decrease your neck pain. So, the answer here is actually false. And this is sort of a misconception because I do wish it were that simple. Now, making some adjustments to your ergonomic setup can maybe help with neck pain. But what's really interesting, and I've been in heated debates about this, is that there is no perfect posture. And the best position is your next position. And the research supports that. And I've been a clinician long enough to remember putting people in posture shirts and back braces to try to like get this perfect posture. But that causes problems in and of itself because every body is a little different. So if you have neck pain, this is a great time to sign up for a program like Hinge Health to address the root cause of your pain. All right, I'm going to move these a little quicker. All right, next one is surgery is the best solution for meniscus tears. I think you guys are picking up on that I'm trying to trick you, so great. False. Yeah, the answer here is false. Now, approximately 60 to 70% of meniscus tears can be treated conservatively, depending on factors like the type, the location, as well as, the patient's age and activity. But a lot of people hear, I have a tear, they automatically think they need surgery. But it's really exciting to see that conservative care does really treats these really well. All right. Exercising with bad form leads to injury. True or false? True, 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 true. All right. Okay, this is a hot tip here, but the answer here is false. So the fitness industry wants you to think there are many ways to squat or lunge and to do it safely. You have to have this perfect form where your knees are over your second toe and everything is right. Now, I think what is important here is that the important thing is that you want to do movements that feel good for your body. And if that means that your knees is over your second toe and your weight is in your heels and that feels good, awesome. But if your knee goes past your toe and it feels fine, you're okay. So that's a big one, is that I think people are really afraid to do things with bad form, but if it feels good, you're doing all right. Now the next one is chiropractic adjustments help realign your spine. True or false? Okay, good. False. I see some truths, a little mixed bag here. Okay, great. So answer here, false. While a good manipulation can help you feel good in the moment, because whenever you pop a joint, there's an analgesic effect that happens that is why people do it. It feels good. But your spine is in good alignment just the way it is. What helps keep your spine in good alignment is making sure that you move, that you get a healthy balance of strengthening and flexibility in your routine. But your spine is in great alignment just the way it is. All right, last one is that pain is all in your brain. True or false? Okay, see a true. Awesome. Okay. Okay, great. So, pain is all in your brain. This is actually true. So, this does not mean that your pain is made up or it's all in your head. But what this does mean is that your brain decides whether or not a stimulus is dangerous or not, and then it signals to your body what to do about it. For example, you're walking down a street, a bus is headed right towards you. But in that moment, you sprain your ankle, but you're about to get hit by a bus. Does your ankle hurt in that moment? No, it does not. You're able to get up, you're able to run out of the way so you don't get hit by the bus. But if you're just walking leisurely, having your coffee, and you sprain your ankle, there's no other threat. Does your ankle hurt? Yes, it does. Your brain is built to protect you and make decisions based on threat and survival. So the same injury, one time it hurts, the other time it doesn't. So it's really, really cool. And this is what I'm excited to kind of dive into a little bit on today. So hopefully that was interesting. Hopefully we learned a few things. Obviously, these are all, like everything in healthcare and medicine, nothing is finite, nothing is 100%, but these are kind of some general myths and things that I hear about a lot as a clinician. Now, every year here at Hinge Health, we do something called the State of MSK, where we survey over 10,000 Americans and their experience with pain. And what we found is that 1 in 2 Americans are experiencing musculoskeletal conditions right now. And that's anything from knee pain, back pain, neck pain, conditions related to pelvic health conditions. And unfortunately, they might not be getting the care they need. And why is that? Well, physical therapy or conservative care, which is often prescribed and it's actually clinically evidenced to be the most effective, can be really inconvenient. It's difficult to access, it's difficult to stick with. And not being able to access physical therapy can then lead to surgeries that are often unnecessary, injections, opioids, and pain medications that are being overused and overprescribed. And as you see here, MSK pain truly affects every part of our lives, from our sleep to our work productivity, and pain very rarely exists all on its own. Now, the numbers related to mental health here really struck me, and there's a really high correlation between pain and anxiety and depression, reinforcing that pain doesn't just affect someone's physical health. So it's kind of interesting to see some of these statistics here on how pain influences our mental health. And this is always a challenge when treating people. Not only are you treating their physical shoulder pain, but also those secondarily addressing their mental health as well. And this makes sense because if you can't garden or pick up your kids, it's going to affect you mentally. And while that might seem obvious, there are some not so obvious reasons for this. Now, pain and depression, they actually share the same neural pathways in our brain. And because of this, it's no surprise that 65% of people with depression also have chronic pain. All right, so I do want to just nerd out just a little bit to talk about the brain and what happens here. So, pain is a normal and personal human experience. But as we learn more about pain, what's been the most groundbreaking discovery is the fact that pain is not something that happens to us, but it's in fact an output of the brain. So, how many people here have, maybe had a bruise on your body and you have no idea how you got it? So you have tissue injury, but maybe not necessarily pain. You don't really remember an injury, but there's some random bruise. The brain takes information in, it has to analyze it. If you sprain your ankle, it hurts. Yes. If you walk across a busy street, you roll your ankle, but a bus is speeding towards you, does your ankle hurt? No. So what's really cool here is that pain is 100% produced by our brain based on perception of threat. Our eyes, they contain light receptors, not vision. We don't see with our eyes, we see with our brain. And that's why half of the population has seen Bigfoot and the other half hasn't. That's just a bad joke. Our ears, they contain vibration receptors, not hearing. Our tissue, they contain nociceptive receptors, not pain, because injury and pain are two different things. And many times we can't change what's in our tissues, but we can change the way we think about it. Tissue injury can correlate with pain, but it's just a piece of a puzzle. Something that influences this is our environment. Environment factors can drive a pain experience up or it can calm a pain experience down. And this has been very well documented. What's really cool is that they did some studies on kids that play contact sports early in life. What they found was that those kids experienced less chronic pain later in life. And why is that? Well, they learn about pain in a fun, socially acceptable environment. They looked at rodeo clowns. These guys have so many fractures in their body. They have tissue injury, but they're in an environment that helps modulate their pain because they're having a good time. Current research also shows that if you hurt yourself in a high stress environment, your chances of chronic pain are 8 times higher. So tissues get injured, but the environment can make it better or worse based on your experience. Now, almost all tissue injuries heal in less than 6 months. But many people, they continue to feel pain. Why is that? Well, pain science research shows us that the nervous system, the nerves, your spinal cord, most importantly, your brain, they become overprotective and oversensitive. So, a condition that we call central sensitization. So, the system is essentially becoming too good at generating pain. Just as the nervous system can learn to throw a ball or to solve a math problem, unfortunately, it can also learn to generate pain. And this is why someone can experience pain that persists even after an injury has physically healed and when there is no danger of injury. Now, a couple areas of our brain I want to just chat about is one, the hippocampus. That's responsible for memory. So, everyone on the call, I want you to think back to a really great vacation. When you close your eyes, can you see the vacation? Can you see the beaches, the beautiful water? Sure, your visual cortex is now lighting up. When you close your eyes, can you smell the ocean or maybe the suntan lotion? Now another area of your brain is lighting up. When you think about your vacation, multiple areas of your brain light up and start talking to each other. The areas of the brain that light up from a past experience are also the same areas that will light up with someone who has chronic pain. Now, the amygdala helps make the decision. It looks at the situation if you're in danger or not. So I think what's important here is that there is no pain area of the brain. No matter what your condition is, there are always about 9 areas of the brain that light up. These 9 areas, they have other jobs to do, but when pain comes along, it hijacks that. And why? Well, because without pain, you'd actually, a high likelihood of that you would be dead. You would be injured or something bad would happen to you because that's how your body protects itself. So cool. Let me build this out. Okay, perfect. So, what's important to remember here is that pain does have a purpose. It catches our attention, it draws our attention to an area of the body where action might be necessary. Just like when you touch a hot stove, you immediately pull your hand away. But if you didn't have a pain receptor, you would just keep your hand there. You'd have no idea that that hurt or that that was hot. So I want to just come back to injury and pain are two different things, and that pain is not always an indicator of damage. So I've got two really cool stories here I want to share. So the first one with that boot. So there was a builder accidentally, he jumped off of kind of the back of his truck and he landed on a really sharp nail and it pierced his work boot all the way through. Extreme pain, obviously. They called the ambulance. His pain was uncontrollable. They're pumping him full of meds. He gets to the ER, still cannot get his pain under control. Nothing was helping. They sawed through his boot to remove it, only to find that that nail had gone between his toes and there was no damage to his body whatsoever. But he was in extreme pain, but no tissue damage. The next story that was documented was that there was a World War II vet who was home living his life, watching his grandkids grow up. And, like all men, he's not going to the doctor. And his wife finally convinced him to go get a physical. And he had a routine chest x-ray and they found a bullet from 60 years ago. He had no recollection of this injury at all. So now you have tissue damage but no pain. So just really, really interesting. I'm sure in the adrenaline throes of war, he had no idea and was probably just trying to survive and help his colleagues out. So really interesting story there. So I've mentioned that pain is personal and it's complex, but I want to talk a little bit more about how lifestyle factors can influence pain. So we all have different drivers to our pain. And now this chart just shows several different factors that can often coexist with chronic pain. So we talked a little bit about depression, but any one of these can have a cyclical effect on pain. So take sleep, for example. Obviously it's difficult to sleep if you're in a lot of pain. But poor sleep or lack of sleep also makes it difficult for the tissues in our body to heal if there is injury. Also, we need quality sleep to feel emotionally resilient. And then when you can't sleep, when you wake up the next day, now you're tired, and now your perception of pain is even greater, and which makes it then harder to sleep the next night. So that cycle can get really hard, to break. Another great example is being overweight. Now, not only can being overweight predispose you to being inactive, but the added load on your joints can also perpetuate pain. On the flip side, people's use of GLP-1s have helped a lot of people lose weight. The problem here is that they're losing weight at an alarmingly fast rate and they're losing a lot of muscle mass. And when we decrease muscle mass, your likelihood of injury increases. So without doubling down on lifestyle and behavior change, this again continues to be a cyclical problem. But another driver is someone's mindset. I kind of touched a little bit on that earlier. Again, a lot of really fun stories out there on this, but they did a study on demolition derby drivers. These guys crash their cars 50 times an evening. In a year, they go to 30 events around the country crashing their cars. But less than 10% of these guys have chronic pain. They are having the time of their life. Then you look at the second picture, he doesn't look so excited. And we already touched on, being in a stressful situation when you injure yourself increases your risk of chronic pain. So mindset really does matter. Now, hopefully, you all have a sense of just how important the brain is when dealing with chronic pain and having a better understanding on just how complex pain is. Pain is normal. And again, without it, we would be severely injured or maybe even not survive some of these simple things. So living in pain is not normal. And for those in pain, 60% of individuals, they feel out of control when dealing with their symptoms. And now the good news is that we can help change people's mindsets. We can do this through education, more frequent interactions with the clinical team. And this is where digital solutions like Hinge Health can really shine because we're able to provide more accessible and consistent care that can help address these complex needs. They really are able to overcome a lot of the barriers people face, especially when it comes to social determinants of health. Now, another kind of nice way to think about how your body experiences pain is to think about items in a backpack. So for a lot of us, we can put a lot of things in that backpack and still zip it up nice and we can still carry it. So things like, exercise, sleep, cooking dinner, work, we can fit all that in the backpack. But sometimes that backpack can't fit any more items and maybe it overflows, um, you know, and make it really hard to carry, like unexpected illness or doctor's appointments, depression, or all these things start to add up. And when you can't close your backpack, that's when your body starts to really feel it. So if you have chronic pain, it's nice to do a quick inventory of what all is in your backpack and maybe taking a few of those items out for the time being can help lighten that load. So, by now you're all experts. You understand pain and the role our brain plays, but understanding how lifestyle can influence how we experience pain. So, I want to go over just again some common myths around chronic pain that I hear again a lot as a clinician. So, the first one is that rest is best. Now, actually, what's really helpful is gentle movements and moving in pain-free ways, but totally resting can actually sometimes make some conditions worse. The next one is that pain means that there is damage. Hopefully, I made that clear with some really fun stories on, this is not always true. Sure, sometimes, you sprain your ankle, you tear ligaments, that hurts. So there are definitely plenty of times where pain and damage go together, but not always. And especially when we talk about chronic pain, they did a really, again, a lot of interesting studies, but they looked at people with chronic low back pain and they found 85% of people with chronic low back pain have no structural damage when they look at an image or an MRI or an X-ray. And I can't tell you how many patients I've treated with chronic back pain. They go to their doctor and their doctor says, yeah, your spine looks good. Maybe there's a little arthritis, but everything, there's nothing else noticeable. So this is a real thing. The next myth is that I'll need surgery to fix it. And more times than not, surgery doesn't always fix the root cause. And that's really where conservative care is gold standard treatment here. The next myth is that medications are the only thing that will help. And sometimes that's true. Sometimes people need that external kind of control to break the cycle. But again, one very small piece of the puzzle when there are so many other things that you can do to help. The last myth is that it's a normal part of aging. No one needs to live in pain. And even if you have arthritis, there are things you can do so that you do not have to think pain is a normal experience. All right, hopefully you found this content interesting, but I know a lot of you are probably wondering, okay, great. Uh, what do I do about my pain? So while everyone's experience of pain is extremely unique and different, there are some general tips that are a good place to start. So find what works for you. But the first is getting in physical activity into your day. Exercise has been shown to help people with chronic pain in several ways, from improving functional strength to improving sleep, cognition, heart health, the list goes on. And just a quick plug here is that you don't need to exercise for 30 or 45 minutes and work up a sweat. They have actually done really interesting research that shows even small nuggets of movement, 2 to 3 minutes, have a cumulative effect throughout the day. And I always have people pull out their phones. You can go into the settings and look at your screen time. So when you're scrolling for 2 minutes here and there, that may add up to hours. Exercise has been actually found to be similar. So doing 2 to 3 minutes sprinkled throughout your day has a cumulative effect here. So just because you don't have 30 minutes to work up a sweat, it's actually just as beneficial to sprinkle it in throughout the day. But making some lifestyle changes, and that's where having a health coach like in the Hinge Health program can be really beneficial because lifestyle changes play a big role in managing chronic pain by addressing root causes, not just the symptoms. So things like quality sleep, balanced nutrition, stress reduction, then how that can lower inflammation, improve tissue health, and rewire the nervous system and how that responds to pain. So it's not about a quick fix, but it's about building habits that help the body become more resilient over time and stay that way for the long run. And then lastly, a healthy diet. I think we all know this, but it can help reduce chronic pain by lowering that systemic inflammation. It's going to support tissue repair, fueling energy for movement. So nutrient-rich foods like fruit, vegetable, lean proteins, healthy fats, can help the body heal and keep the nervous system balanced, all of which can really make pain feel more manageable over time. Now, while there's no question on the benefits of exercise, for our entire well-being, when you're in chronic pain, it is extremely helpful to make sure that your program is tailored to your unique needs. And what's really cool about movement, and doing it in a pain-free way is that you can actually start to retrain your brain to know that movement is safe. And that once you start retraining your brain, you can continue to slowly progress. Now, with that in mind, I do want to take everyone through a little movement break. So I took some of my favorite exercises from the Hinge Health app. So please feel free to follow along, move in ways that feel good to you. So feel free to modify the range of motion, or if something doesn't feel good, just sit that one out. But I just got a couple because I do want everyone to kind of make a note of just doing a couple minutes really does make a big difference here. So the first one, really easy, head rotation. How much time does everyone spend just staring at a computer screen? Straightforward. Super simple, but all you need to do is rotate to the right, rotate to the left, nice and slow. You might notice after you do a couple of them, you can go a little bit further. Maybe it feels a little less tight. What's really cool about our joints is that they have a way of self-lubricating, and they do that by gentle movements. So you'll see a couple exercises in this Hinge Health program that they're not intense, but they're made to just get your body moving so that mobility is improved, that synovial fluid in the joint is improved. So this is super easy one that everyone can do throughout their day. Next one is a seated cat cow. Now, some people might be familiar with this from yoga where you do it on the ground. And if this doesn't feel good for your shoulders, you can just keep your hands on your lap. But all you're going to do here is you're going to round and kind of curl, tuck your tail under, and then you're going to arch your back and look up. Now, what I also like to have people do is coordinate this with their breath, where they exhale as they curl, inhale, kind of expand the lungs. And I always like to have people inhale through the nose, exhale through the mouth. So you can kind of get a nice rhythm going here. But again, this is another one where you might feel a little stiff. As you do a few more, you can go a little bit more into that curl, maybe a little bit more into that extension. If you have any type of spine pain, whether it's neck pain, mid back pain, low back pain, this is a great one because our spine really doesn't get great blood flow on its own. It relies on gentle movement to kind of have some of that muscle pump action to bring rich oxygenated blood and fluid to the area. So again, really easy one that you can do right at your desk. All right, the next one is just a wrist mobility exercise. So if you've got things like carpal tunnel, or even elbow pain, this one can be helpful. This is not a really intense stretch, but you're keeping your palms together. As you bring it down, you'll notice the angle of your wrist increases. So you might be able to go a little bit further, but just take this one nice and slow, up and down. Again, not a real intense stretch, but a nice one just from a gentle mobility. If you spend a lot of time with a mouse or at a keyboard, just to move your wrists a little bit. So this is, again, really easy. I really like this one. Next up is knee extension. So just sitting, you're just going to kick one leg out. And as you extend, you really want to try to engage that quad and back down. And I usually have people alternate, one versus the other. But again, you want to engage that quad as you extend. But this is also nice if you have knee arthritis, which most people do. If you're a walking human being and you've lived long enough, you're probably going to have some arthritis in your knee. So this is really nice. Again, a gentle mobility exercise where the more you move it, it starts to loosen up. That synovial fluid starts to increase in your joint. So really easy, simple to do at your desk if you do have knee stiffness. Super easy. I love this one. Next one, another great one. You can do this laying down, easy enough to do just at your chair where you just bring your toes up towards your nose and then point them down. You could do this standing where you're just doing some calf raises or just kind of wiggling one ankle up and down at a time, or maybe in bed if you've got plantar fasciitis. This is a wonderful one to do before you even get out of bed in the morning because it's going to loosen up that Achilles tendon. It's going to stretch the calves out a little bit. If you notice at the end of the day, maybe your ankles are a little swollen, this is another great exercise to help kind of push some of that lymphatic fluid back up through the rest of your body. Again, that muscle pump action is really, really powerful at kind of helping with some of that fluid that kind of sits there throughout the day, especially if you're sitting a lot and your legs are just kind of down. So again, love this one. All right, this would not be a movement break without getting you out of your chair a little bit. So if you would humor me, we're just going to stand up and sit down. You could also do a mini squat here if that feels better to you. But I love incorporating these into my movement breaks because we sit a lot. You've been sitting listening to me, you know, babble on for the last half hour. But sitting and standing or squats or mini squats, they're one of the most functional exercises. They activate the biggest muscles in our body. They help from low back pain to hip pain to knee pain, just really being adding some mobility to all those big areas there. So I had to get everyone just standing for just a couple repetitions. All right, perfect. Well, thank you everyone for following along and humoring me. But hopefully those exercises felt good. I know I always feel better after just a few minutes of moving around, and that's where Hinge Health is really great because when you join, you get a dedicated physical therapist. You get personalized exercises that are tailored to you and your condition, as well as education that is customized to your needs. Now, just a quick snapshot of what it looks like. I just want to kind of quickly go over kind of where Hinge Health fits in here. So a quick snapshot of what the Hinge Health app looks like. So everything that you need is right within the Hinge Health app. So that's where you can schedule visits with your physical therapist. You can pull up that video visit when it's time to meet them right within the app, where you can talk to your physical therapist about your condition. All of the exercises that your physical therapist prescribes will also be right on the home screen, as well as any education that's based on your condition. And what members also really love is the ability to just send their physical therapist a message right within the app whenever they need. So you've always got really easy access to your clinical team. So imagine just a personalized plan that targets your specific pain points, provides you with expert guidance, and it's all done from the comfort of your own home. Hinge Health offers all of this and more completely free to you as part of your employee benefits. So whether that's getting help from a recent pickleball injury or needing care from years of low back pain that you've had, or maybe you're recovering from a surgery, we can put a plan together that will be just for you. So if this sounds interesting, or if maybe you have an ache or pain and you want to talk to someone about it and get some guided movements, getting started is really easy. So you can go to the MESSA dedicated page here, that hinge.health/MESSA-OE. You can scan the QR code to make it really easy. That'll take you to the dedicated landing page, and that's where you're going to fill out a clinical screener. Now, just a heads up, this takes about 10 minutes to fill out because we're going to ask about your pain, how long you've had it, a little bit more details around your condition. Once you're done there, you can download the Hinge Health app, you can log in, and you can get started right away. I mean, if anyone on the line is scanning the QR code and signing up now, you could probably talk to a physical therapist by lunchtime or maybe after lunch. I don't know, whatever time it is there. So it's extremely easy to get started and get that personalized plan right away. So with that, I'll turn it over to you. I'm going to leave this screen up for everyone who wants to scan or go to the website there. But hopefully it's interesting for me. So hopefully it's interesting for you to learn a little bit more about, pain and how we experience it. But love to answer questions on the
Oh, Sandy.
program or anything else. Rhonda, I'll turn it to you.
Thank you, Dr. Christine. That was fabulous. I love, love, love nerds. I love
Okay,
people
good.
that nerd out. I do, I do. I love it. Let me see. It looks like Sandy's here. Thank you for coming, Sandy, the client exec. And looks like she's answering some questions in the chat for us. Are there any other questions? Anyone? I think this connected so well about how our mood, our brain really modulates pain.
Yeah.
That stuff is so interesting to me. And when you were asking the question about is pain in the brain, I am one of these people. I love spy movies. I like Born Identity and the double agents when they are captured and they have to get free and they don't feel any pain. And I thought
Right,
about that.
exactly.
They train themselves to I don't know the right word to use, but they can go past pain to do what they need to do. The adrenaline, they get in that survival mode and they can swim across the ocean, they can jump off a plane. And I just love those types of movies. So I immediately thought of that. And it's so true. We have
Oh,
a lot of superhero type CIA, FBI people in the school districts. They work like that. They operate like that often. But this fits perfectly. Any more questions in the chat? They're not. Thank you so much. I know this might have been a last minute thing for you. Excellent information. We'd love to have the slides and give this information out to our members and use Hinge Health. I use Hinge Health, and I love it. I went from a hip problem to a shoulder problem. I'm in that midlife area
yeah.
where they call it musculoskeletal syndrome, ladies, and menopause. So, but it's been very useful. And there is hope. Even with the decline in estrogen, exercise helps the muscle to remodel itself. Am I right, Dr. Kristen?
You are right.
Yeah. So I'm finding it to be helpful.
That is
Movement is
great.
very important. So thank you so much.